I'm Lila Lazarus. What you're about to see is changing the way dentists practice dentistry. Plenty of dentists shy away from doing implants, even when it's the best option for their patient. Maybe they don't know how to do an implant, or maybe they're not confident in their abilities, or maybe you're just afraid. What you're about to see could change all that.
I'll start suturing after I tuck the membrane down under the lingual flap.
You're watching dental implant surgery.
I've got her flapped and I've already got the membrane in place.
And this dentist has never done this type of surgery before.
We weren't taught it in dental school. The technology wasn't where it is now. And you don't have a course like Ladera Ranch.
He's talking about Ladera Ranch Implant Institute, where these dentists are learning a practical approach to implant dentistry.
If you look here, what you'll notice is that you have plenty of room over the sinus.
As you can see, it's hands-on. The dentist learns about implant dentistry.
So you're going to realize when you start prepping these that you have to kick it out a little on the bottom.
And immediately gets to work on a patient.
What kind of suture do you think you want to put there?
We use Vicryl.
Okay. It really allows people to feel the joy of their profession again.
This program was started by Dr. Todd Engel in Ladera Ranch, California.
You can work on a model, you can work on a cadaver, and that's wonderful. But until you really work on a live human being, it just doesn't feel the same.
And it's now taught across the country, in Los Angeles, Portland, Seattle, Scottsdale, Dallas, Chicago, Toronto, Detroit, and Cleveland. More than 650 dentists have been through the Ladera Ranch implant program, learning dental implant techniques under the close supervision and guidance of top implant dentist mentors.
So you're actually going to place your first implant on a live person and get the entire experience of placing a dental implant in a 3-day seminar.
It's a way to improve your dental practice, but also transform a patient's life.
Nice to see you.
Nice to see you.
Well, are you excited?
The patients that participate in this program get more attention than usual.
Eleanor, how you doing? Mm-hmm. Good, perfect, me too.
And state-of-the-art dental implants.
I couldn't use the left side of my mouth for chewing because I was concerned the bridge was loose, but I needed to find the right people to help me, and I did.
And they get it all at a drastically reduced rate.
The cost saving is just phenomenal. You just can't even believe it, and here I am.
Here's how the program works.
We went in 3 to 4 millimeters into bone. We took an image.
The first 2 days of the course, you learn strategies for safe, predictable implant placement, first in lectures.
It's a rubber band and it protects teeth and implants from biologic invasion.
And then a live surgery demonstration.
We're going to go down about 7 millimeters. We'll take an x-ray.
Then comes day 3. The dentists are anxious.
Even though I have some experience, there's always a little stage fright.
Well, I was a little nervous last night. I barely slept.
Though many have practiced dentistry for years, for most, this is their first attempt at placing implants in a live patient. But they have a mentor watching every move.
The good thing about this program, your hand is held through every step from start to finish.
And when it comes to learning your craft, nothing compares to working on a live patient under real conditions.
You tell someone something and they forget it. You show them something they'll remember, but when they do it, they'll know it.
The hands-on experience, it is unbelievable for me. It is worth, to me, it's worth $1 million.
And when it's over,
I placed my first implant. I'm very satisfied. It was a little stressful, but I made it.
And what do you think about that?
I like it.
But will they now add implants to their practice?
I'm going Monday. I'm going to start talking about implants, do implants in my office, that's for sure.
Am I going to go home and do it? And yes, matter of fact, we already have 10 cases lined up.
No more sending the implant patients elsewhere. Now these dentists will do the implants themselves.
Now it's going to be perfect every time.
For more information, just go to LaderaImplants.com.